Well, good morning. Before we officially start, I was hoping that Rachel Statzenberger was here because I was going to say, if we have to go late tonight again, she's going to be buying more shoes. So I hardly ever use my Twitter, but I was looking at that late that night, and she was buying a couple pairs of shoes. So I said, get ready to buy some more. But anyway, with that, let's get started. Good to see you all again this morning. I'm very proud of what the Republicans have accomplished so far. We've already dealt with 7 major budget bills. We're going to do 3 more this week. HHS is the one that we're going to talk about today. It's probably the most complex. There's so many things that we have to work with in that area. It addresses people that are hurt in Minnesota, the seniors, at-risk children, the disabled, and how we make all that work is sometimes not easy. That budget is growing at a rate of 20% if we do nothing. The plan that we're rolling out actually shrinks it down to an 18% growth, which is still $2.2 billion increase. And so there's a lot of issues that are in there too that I wanted to highlight that I care about. There's increased funding to deal with the sex trafficking issue in Minnesota. It's something I care about. I've just had contact with people that have come out of that, and I see the struggle, and I want to reach out and make a difference in Minnesota. And then I also see that we've done a few initiatives towards mental health. We're taking steps in that direction as well. But there are many, many more issues, and I wanted the experts to introduce that to you. So with that, here's Senator Michelle Benson.
Good morning, and thank you for joining us. Health and Human Services is, as Senator Gazelka said, complex. You can touch people's lives in very positive ways, or you can put them on a trajectory that will leave them dependent on the state for a long time to come. And with 22% growth forecasted, we have to take responsible action now to start bending the cost curve. A few things that we've done, Senator Rosen's leadership on opioid addiction, we have to help people stop the scourge of opioids. Senator Rosen has also taken a leadership position on dental for Greater Minnesota. We know it's an ongoing problem. And for children to grow up healthy, for families to grow up healthy, they're going to need access to more dental coverage. And Senator Rosen's also taken a strong leadership position on those people with mental illness who are at risk for incarceration. Those priorities are reflected in this budget. I've carried significant health reform up to this point in session. Some of that work is reflected in this budget bill as well. Policy provisions such as expanding network access, expanding primary care provider access for those people who are in the individual market. But the biggest cheerleading items in this budget are the way we focus on how we're going to care for the elderly going forward and how we're going to care for the disabled going forward. And Senator Karen Housley has been a leader on caring for the elderly, and Senator Jim Abler has made the disabled one of his strongest priorities this year. And so I'm going to turn this over first to Senator Housley and then to Senator Abler. Thank you.
Thank you, Senator Benson. Senator Karen Housley, Chair of the Aging Long-Term Care Committee. It's a new committee in the Minnesota Senate this year, and I want to thank these people behind me for allowing me to chair it because it has been one of the greatest honors that I've had in the Minnesota Senate. The aging population is going to double by the year 2040. And even by the year 2020, for every one working adult in the state of Minnesota, there will be 21 adults over the age of 65. So this is an area that we really do need to focus on. There's immediate needs, and we have to continually look at it. Our committee worked bipartisanly, and we worked really, really hard at the reforms and ideas that we could implement this session to help this population. One of them that came to the forefront during committee work was the Elderly Waiver Program. I don't know why it's called the Elderly Waiver Program because nobody can understand the word elderly waiver. It should be Elderly Home Support Services, but it's called Elderly Waiver. And what Elderly Waiver Program is in-home supports for those 65 and older who qualify. In-home supports such as meal delivery, transportation, caregiver services such as bathing and chores. So this is important because it will help keep the older adult in their home for as long as possible. Two things. One, it's what the older adult wants to do, stay in their home or their community as long as possible and not go into a nursing home facility. And two, it's also the most cost-effective for the state. Currently, we have 30,000 people enrolled in our elderly waiver program, and it saves the state up to $3,200 per month per person. So thank you to Senator Abler and Senator Benson for including some of the bills that we had and for provisions in the HHS omnibus budget bill for reforms and some resources to grow our elderly waiver program. Secondly, what we became aware of in committee work, which was pretty disturbing, is the Office of Health Facility Complaints, the OHFC, which is under the Minnesota Department of Health, is having some real struggles currently with the number of complaints coming in and their inability to research the complaints, investigate, and get the reports out there. It's taking up to a year or more for a complaint of abuse on a vulnerable adult for the reports to get done and posted. They are overwhelmed to the point where they can only investigate 1% of the complaints that are coming in. So in this bill, we have resources to the Office of Health Facility Complaints to get more people on the ground, more boots on the ground, to get investigators out to the facilities, to the homes, to investigate these reports, and also some funds to go towards their IT tech system. Currently, the OHFC is operating on a paper-based system, which is inefficient. We took a tour over through the Office of Health Facility Complaints and saw the stacks and stacks of paper and the inefficiency. So we have some funds going to an IT program, to a case management system to help streamline that. And also, finally, in this bill, something I'm very proud of, it was brought to me by the American Cancer Network, Cancer Action Network, is the Palliative Care Advisory Council. Palliative care is a relatively new term to our culture. It is care services to take care of the symptoms of chronic diseases such as cancer, ALS, Alzheimer's, chronic heart disease, and symptoms such as nausea, sleeplessness, depression. This takes care, the palliative care services helps these individuals live a better quality of life if they can take care of these symptoms. Sometimes they live for years with these diseases. So in this bill is a palliative care advisory council, which can help grow and make people aware in the state of Minnesota of the resources that are available. And thank you, all of you, for including these in your big bill. Thank you. And then Jim, Mr. Frost.
Well, this is just, I didn't bring this for a prop. I was just taking it on the way to the floor. Like, oh, we have to go. So human service is a very simple topic. And so a lot of people have a hard time sleeping. I suggest, for free, you can get one of these and see how far you can get through it before you nod off. But it's complex, but it's extremely important. In this budget, we're going to spend $15.4 billion to serve 1.1 million people. Last time, in the last budget, we served about 1.1 million people, so everybody's going to be served. The way you change the ability of Minnesota to serve and the way you make it achieve realistic budget expectations is to do things a bit different. And this bill, and this box, actually, are full of ideas. We didn't get them all done. We have more ideas for the future. But what we've done in this bill with the priorities that we're going to express are about serving the people with disabilities, the frail elderly, you heard about that, and kids. And so with the people with disabilities, they're living often in group homes, they work in institutions, and the goal is to make them move toward more independent living and more independent work capacity work opportunities that they have. And this bill is moving us in that direction in a new, emphasized way. There are some people who are in their homes that have very complex needs, quadriplegics, people with severe needs that can't get out of bed by themselves. We're able to give them a rate increase for the PCAs who would serve them, and I'm very happy that we can do that. And then there's these facilities that serve them, the day training places, the corporate homes, the different service, both independent living service companies and those that provide services in more congregate settings. We did a lot of work to try to, the rates changed through a state effort, and federal changes have all come to land on them to put them greatly at risk. We did a lot of work on that, and there's the beginning of an improvement in this bill that will make a real difference to keep them open and serving. The people only have services when people can, when the service individuals can get there. And so services in name only do not count. And so we're committed to keeping these services available to all the people with disabilities. You've already heard about our work with the frail elderly. And then we did some work with kids. And we are adding $13 to the grant, the cash grant for families. And that's said to be meaningful. And they haven't had a raise, I think, since 1983. And so we're committed to that little bit of difference that we could make with some money we had left over. It turns out, if you're serving all these hundreds of thousands of families at the county level, that they couldn't talk to each other. And so in this bill, you have where for the first time they actually can communicate between themselves with family permission about how to better serve the families. And so without having to take anything away, we can help the counties focus the spending better and actually work to get a child reading by 3rd grade. And if they get reading by 3rd grade, they're on the road to success, and the data shows that very strongly. And so kudos to Dakota County, who led the way in some of this innovation. It's in the bill. We have preserved some children's mental health in here. The federal government changed the rules about how we could serve our children with mental health needs, and so we actually had to pay to keep it the same. But we were committed to making sure that those 700 beds stayed open, and we did that. And then finally, we reopened an old program called the At-Home Infant Care Program, which is where a person who was otherwise eligible to be on child care assistance could stay home with their new infant for a year, and they get paid 60%. And so there's no one best suited to raise a child as their parent. And so we're excited about this. There are a few other features, but I think I will stop there. And just remembering that human life matters. The respect for life starts with those who are the least able to take care of themselves, and this bill actually does that in a very strong way. Thank you.
Any questions?
You talked about the importance of bending the cost curve on HHS, which has grown to be an ever larger share of the budget. But most of the big cuts in your bill are actually shifts. So I was wondering if you would talk about reconciling the desire to bend that cost curve and the fact that most of the money that's being delayed isn't actually savings, it's just pushing it off into the next fiscal year.
And there was an excellent article in the Pioneer Press this weekend that raised that point. And with regard to the payment delays, reform takes a long time in HHS. We didn't get here. Human services is 32% of our general fund budget. By 2020, we'll be spending about $40 billion in all funds. And bending the cost curve while minimizing the harm you cause in people's lives and allowing them to transition is not something that should be done rashly. And frankly, we were sworn in January, and we are taking a really good shot at this first budget. But there is more work to do, and we welcome everybody to come to the table with ideas about how we better serve the elderly and the disabled so that they can achieve their full potential, but so we can bend the cost curve on this budget. There will be no easy answers, and it will take time, but we are giving this our best first blush.
How tough will the negotiations be in conference on this bill? And do you think in the three-way negotiations you've already staked out some middle ground compromise with this bill?
I think we've taken reasonable positions on those things that are important to our caucus, the elderly, the disabled, starting to take care of children in a different way. The governor wants the provider tax increased, and then he uses the Health Care Access Fund to backfill and mask some of the general fund spending on human services. We would prefer to be very straightforward with the people of Minnesota. This is what it costs to fund human services programs that the people of Minnesota have come to expect and be dependent on. The Health Care Access Fund was used in the reinsurance program, and I think we should leave that as a last resort as we go into negotiations. The House has also protected the Health Care Access Fund in their budget. They took some deeper cuts. They looked at program integrity. They have a different standard for their fiscal reporting than we do. I believe we can make some gains in program integrity, that is cutting out waste, fraud, and abuse. The House affirmatively took that position. We have to craft language and programs in order to take those kinds of savings out of this budget. The work's going to continue, and we'll get there.
Can you expand a little more on what you mean by that? That they have different standards in terms of are they able to be a little bit more aggressive in terms of what they say they're going to cut? Is that what you're saying?
We have to have fiscal notes, and they do not. And getting a fiscal note crafted that shows $100 million in program integrity savings requires a lot of cooperation from the Department of Human Services, and that work is ongoing. The Department of Human Services is going to take a position that they need to prioritize technology, and this is where MNsure comes into play. MNsure was supposed to be our eligibility platform, and if you look at the reports of the legislative auditor, MNsure is not doing its job. Our counties are overwhelmed with paper processing and paper reprocessing, and it is causing some program integrity problems, and so we do have a significant opportunity to recapture savings through waste, fraud, and abuse mitigation.
Did I understand 1.1 million will be served under this bill, the same as last time?
Yes.
I assume you have some coming and some going. Can you folks tell me what types of people will be served under this bill who haven't been, and who won't be served, who have been?
The elderly and disabled population. The elderly population is growing. The disabled population is growing a little bit as well. The remainder of the population are people who move in and out of our poverty programs. For example, the Minnesota Family Investment Program, 10 months is sort of a median point. They come on, they stay on for 10 months, and then they move off. So it's not if you're not elderly and disabled, you are probably moving in and out of these programs. But if you're elderly and disabled, this becomes a very stable population.
So are you saying that as more elderly and disabled move in, that you may be serving fewer poor people?
The only way we're going to contain this budget is if we have as many people living independently as possible.
So is that yes or no?
Our population's aging, and we have not gotten everything in place we need to prepare for it. That's why Senator Housley was working on a committee focused just on that. I'll let Senator Abler address the elderly disabled. That was his purview.
Well, and just to make the point of that intervention in the early families in the MFIP side and county services is to help them get done. And so we're a very humane state. We agree we should give people a hand up and as they're moving through, and to give them a safety line to help them pull themselves through. And this bill builds very strongly on that in terms of helping people have a successful intervention and then get done. It also builds on the people with disabilities having more independence and actually needing less service. So the number may be the same or fluctuate based upon who's out there. The waiting lists are very small, so there's not any pent-up demand. And that's going to be still improving as this bill moves forward. But if we can serve people in the best, least possible way to help them achieve the highest outcome, that's the point of this bill. That's a reform. You get more service for less money and a greater amount of success. And we are all about people being independent and successful.
All right, thank you.
Thank you very much.
Good day.
Has the governor shared his plan with you for reinsurance today?
I believe he will let it become law, one way or the other. So whether it signs it or doesn't, it's not going to veto.
Is that an informed assurance, or is that your guess?
It's informed. Thank you.
What order are the bills coming?